excited to have the next conversation. We started this conversation about the aging population in our last Health and Wealth of America event, and really thought that talking about it again was really important. So happy here to have with me Dave Icke, who I met when he was the CEO of MC10, now the head of digital health and analytics products at Humana, and Slawek Kierner, the chief data and analytics officer at Humana. Thanks for joining me today.
Good to be here.
So, obviously, the last, year has been an interesting one with the pandemic. You guys sit at a really interesting intersection of technology and healthcare and massive amounts of data. You're ingesting data from your members. You're probably looking at public data sets. One of the things that we started to hear about, when we started this conversation was about this population, the aging population that was really a demographic that was being impacted by lack of connectivity, lack of comfort with technology. We a lot of times talk about the homework gap and different socioeconomic groups that are being left behind. But it was the aging population, I think, that really jumped out to me, and something that Humana, is focused a lot on. Slawek, would love to understand, from the data that you're looking at, talk a little about this population and sort of what you've learned. Maybe what are some of those aha moments or some of those insights from the data that you've gotten that maybe you didn't expect?
Well, thank you, Josh, and you are correct in the fact that we do have loads of data, and especially now during pandemic, we have observed how important this data is to be able to provide adequate healthcare to our seniors, and that ranges through being able to outreach during COVID and make sure that those that are most vulnerable know how to behave, and we've done a lot of those calls, to knowing who might suffer from food insecurity, and that's also one of the aspects which we were able to then help with by providing meals and outreaching to exactly the right type of folks. So that's the power of data that we have. Now you're asking about like some of the epiphanies and insights, and I'm relatively new in healthcare. I came from technology world just 2 years ago, joined Humana, and one aspect that really came to me alive here is this importance of social determinants of health, and how actually we address the zip code that you live on might swing the expectancy for your life, by 10 or even 15 years. So we of course have studied this topic deeply and understand the various aspects of social determinants. But things like social isolation, which is a huge issue in the US, has been even before COVID, and now got even tougher. And of course, the people, the members, the consumers that are socially isolated have a 29% higher risk of premature death. So this just shows that we might not need, frankly, to focus only on the health conditions, but actually treating this determinants of health that come earlier might bring way more value in the industry.
Yeah, and I'd love to, I think we'll talk about what are those various data sets that you think about, both the ones that you were capturing from your own products and services and from providers, as well as, again, to your point, even thinking about other determinants. But Dave, so you sit on the side of really the telehealth and the remote monitoring and the products and services that are touching directly your members. Obviously, I'm sure, as you looked a year and a half ago, you wouldn't have expected the how much more data and how many more members would be accessing services through telehealth and remotely. What did you, sort of see, were you guys ready for that influx as far as the more, I mean, we had the CEO of Amwell on last year, talking about the explosion of how many new telehealth visits they had to handle. But talk a little about some of from a product and services perspective, how you guys were able to accommodate that and what that growth's been like, and even maybe talk a little about what you see post-pandemic, how seniors specifically will now be using these types of services?
Yeah, no, great question. And it's been a wild ride. Be careful what you wish for, right? In working on virtual care and digital health solutions, it's really been a coming of age. And, hopefully if there's a silver lining, we've had a chance to improve these experiences and demonstrate them to a lot of folks that hadn't tried them before, both consumers and members, but also the providers, right? So there's a lot of reluctance sometimes to try new technology. I think we've all been forced to use, whether it's for school, connecting with family, or for healthcare, virtual technology a lot more in the last year. One thing that's really been striking, before the pandemic, a fraction of 1% of our medical visits were via telehealth. Back in May, April, May, June of last year, that spiked up to more than a third of the visits. And what's been surprising is it's come back down as ability to go back into face-to-face visits was reestablished. But, the new normal is about 30 times higher than it once was, right? So it's in that 10 to 15% range now. And I think, there's an interest in consumers' parts and on providers' parts on using telehealth for the right type of thing. And, sort of building on Slawek's point about just some of the loneliness and isolation challenges that our senior population finds. One of the really surprising and, I guess, shocking or, challenging things about the pandemic has been the real tsunami of behavioral health needs, mental health needs for everyone, but including our members. And similar trend where, about 4% of our behavioral health visits prior to the pandemic were via telehealth. They spiked up to about 60% during the beginning of the pandemic. Surprisingly, now still the majority, more than 50%, are happening virtually. And that's a situation where obviously behavioral health, where just a good face-to-face connection is great for providing care and kind of sustaining care. So, it's a great example of where technology acceptance, I think, has changed dramatically and will stick and really, help all of us get access to care in a much more convenient way.
And when you think about, and I wanted, there's probably a question for both of you, there's structured and unstructured data, right? So we think about the easy things, right? Someone logs a number in a chart and you guys are able to look at that data point. But as you think about all of this data that's coming through virtual visits, no matter if it's, technologies like NLP or computer vision to understand how people are, interacting on the camera, maybe, are you really looking, again, at all of these types of data, not just what the person's saying, but how they're saying it, various conditions around audio and video? Would love to just understand how many, what is the doctor and what is the technology really, able to assess?
You want to start with that, Slawek, and then I'll follow up?
Yeah, please go ahead. So Josh, you're asking for things which are very close to our hearts, and we both believe it is a big part of our future. And there are some things that we are doing, and I can talk about them briefly, and some where we are probably contemplating and getting ready from both technology point of view and also from purely the ethics point of view. So before we jumped all the way there, one thing that we've invested a lot over the last year is into our responsible AI practice, and set up the right type of group within Humana to review our practices. We also invested into tools that help us monitor our machine learning and data science models to ensure that they follow equal AI pledge that we have signed and are free of unintended bias. And that's the base that you need to have on the ethical side, so that you can actually unlock more and more of the power that is in the unstructured data.
And I'm assuming that's a lot of your heritage. I mean, we've done a lot of work with Brad Smith at Microsoft around ethical and responsible AI. So obviously, you take probably a lot of that learning from your Microsoft days into Humana.
Exactly, exactly. That's it. We work very closely with Brad Smith, with that team that helped us construct our program as well. And you don't want to jump the gun. You don't want to go too much into kind of large scale NLP and vision processing from this type of calls without proper consent of your members and without proper ethical footprint. Now we are ready from technology charges, from technology standpoint. So there are a couple of things that we've invested to. One is we have our Florence AI platform that actually does have ability to process both structured and unstructured data at high volume. We also have built pipelines, and we are using them right now more in a test mode to process the pre-approval documentation, because you can imagine still how much of this process in healthcare is based on faxes that are being sent to us, which a nurse needs to attach to the proper case and then read sometimes through thousands of pages before they can offer their assessment. So we are using NLP to process those documents to speed up the turnaround times to when the member will get a pre-approval, and hopefully with time even maybe eliminate pre-approvals overall, because all of this will be able to be done very effectively in automated fashion. And that in parallel, what we are doing is maybe we're not going yet to vision, but we process more and more of our phone calls in the service center through transcription to be able to just first of all we have to record phone calls anyway and transcribe certain parts of it because of legal requirements, but we are looking right now into how we can turn this this phone calls, transcribed phone calls into a signal that can then power our models that predict things like likely admission to a hospital, and then warn our care team so that we can contact the member and help them hopefully prevent that kind of situation.
And just to add to that, I think as we envision sort of the clinical visit of the future, we're trying to solve for human needs and kind of invoke human-centered design. I was speaking with a physician this morning, and in a conventional visit, the doc actually spends a lot of time with his or her back to the patient, right? Documenting something in a computer or walking back and forth. And one of the benefits of the virtual visit approach that we're implementing with them is that they are focused, on the needs of the patient, of the consumer, much of the time. And we're working on approaches which will give them all of the relevant information on the screen or on a parallel screen. So they have the context, we call it the longitudinal human record, but really the history of all of the touch points that a member's had with Humana and even with the healthcare system. And, to your point about structured and unstructured data, thinking about contextual data about social determinants and other preferences and lifestyle needs, I think allows us to really try to, meet the member where they are and anticipate some of their needs.
So obviously this is all great. This is like amazing, right? We're talking about how does really technology solve these major problems. But I do want to go back to, now we're talking about a population that historically we'd think of that may not even have a smartphone, that may still have a feature flip phone, that's may not have a PC or a computer in the house. Would love to start to understand, when we kind of think about, this is all great for certain populations. When you start to think about the older and the aging population, how do you get that greater penetration? What is needed to not only have the technology? I mean, we could ship out, devices, but who knows if they're going to come online, and, we're going to, so I'd love to understand a little more, and like, how you think about implementing and scaling these types of solutions specifically within the aging population.
Yeah, it's a great question. And actually, after the public health emergency, CMS relaxed some regulations and allowed us to provide devices to our members, which we found exciting. And we looked for a number of different ways. I think we had, 8 different programs in different corners of our provider network and in different ways that we provide care. And we learned a ton through that whole process. As you say, Josh, it's not just about the device, right? And up to as many as 42% of seniors over 65 don't have access to broadband internet, and so that's a huge challenge. There are, in addition to just the access to service, there's tech comfort and sort of usability barriers that exist. And so thinking about something as simple as putting in a password or remembering a password, sometimes being able to see or hear what's happening in a virtual visit can be huge challenges for members. And so we've looked at ways where we can provide some of the support that's needed, sort of technical support that could come from resources that we have going into the home, home health nurses or folks that do in-home wellness assessments, are a couple examples, but also working with third parties. We've done some things with Best Buy Health, for example, to use their Geek Squad to go in and help to set up devices. And as you know, we have a partnership with an organization called OATS, Older Americans Technology Services. And we can talk more about that a little later, but we have a specific program called the Aging Connected with them, where we're trying to get 1 million seniors without access to have access over the next 3 years. And it's a multi-pronged program.
I forget the number. I mean, 1 million, while it seems like a lot, I mean, how many, you guys did some research. I don't know if you have the numbers offhand of how many millions of seniors are not connected, but I mean, I know you said 42%, but that there's a lot of people.
Yeah, it's I have the number here. I think it may be 42 million.
Yeah.
It's in that range. So it's definitely,
while 1 million sounds like, wow, that's going to be amazing, it's still just scratching the surface.
It is. And the learnings that we get from that, I think, are the important part to kind of carry it forward. But, there's a need to, there are a couple different elements of it, right? One is to get seniors to understand the importance of having broadband access. Not a lot of folks think about internet connectivity related to healthcare and the benefits they can access, not just a telemedicine visit with their provider, but access to information, food, transportation, some of the underlying supports that are really important. We're working in public-private, or OATS is working in public-private partnership to expand lower cost offerings to get internet access into homes, and working with the big wireless providers and ISPs to make that happen. And there's a big push also to develop content and experiences that fit the needs of older adults. And we've developed some of those products ourselves, where for an iPad that we put into the home, we developed a very simplified experience that could connect to a care manager at Humana, and also connect to a physician through a national telemedicine provider should they need that. So, and doing that in a way where they really get one-click access to the care without having, and managing security and privacy while enabling that one-click access is a really difficult challenge, right?
And Slawek, so obviously, as Dave mentioned, so telehealth, as we know, more and more of us know, and may probably had our first telehealth experiences in the last year. But what are other data, when you think about all this data you're ingesting to build models, predictive models, are there other sensors and devices that you start to kind of imagine or that already exist that will live in the home that will give you additional data points to build models with? Or
Yeah, 100%, Josh. And so it's good. So it's a very good question, but there is a lot that I think would be connected from home, and some of these are new sensors that people might want to install, and some are partnerships to just capture signal from sensors that already are there. So we have a couple of programs with MIT, and some of them are undisclosed, but there's quite a lot happening in terms of both monitoring person's health as well as ambient monitoring of home. Which I think with time will be coming there. But you know what? Actually, there's quite a lot of other data that would be interesting from health perspective, where we just need to partner with proper providers. So for example, being able to consume a feed of electricity consumption at home can tell us a lot about the movement and the kind of lifestyle and what happens with a senior. So if we could just grab that signal, it's already a lot. And of course, TV consumption and what we can get. We talked about social isolation earlier, but there's a lot that you can actually reason based on how someone consumes TV, and ranging all the way to mobile. So we talked about virtual visits, and we do see that more and more our contact, our interactions with members actually not happen on PC but on mobile phones. Mm-hmm. And it has been said probably also on your in your conferences many times that the mobile phone probably knows more about us than our spouse. So if we could grab that signal, there is a lot that can be done about this also in context of health and health prediction.
Right. And so it's interesting. I think I was told that you guys are, in either in process of doing a migration onto Azure, like sort of cloud. When you think about all of these different traditionally siloed data sets, right? So you're pulling, again, the ones that you obviously control and own, as well as all these third-party data sets. That must be an enormous sort of undertaking, both from a security and privacy standpoint, as well as just, again, structuring, normalizing data, and really being able to clean and use the data. I mean, where are you in this journey of moving onto Azure and thinking about, how do you bring all this data in?
So first of all, we are very proud from the journey. So first of all, we do have data in Azure. We did find ways of storing it securely there and building very powerful models. Some of the models for predicting social determinants of health, the models related to inpatient admission and enabling us to do the care outreach, including perproviding food to members. So we are already very operational with what we have. On the other hand, if you ask me, how far we probably are, 5% there or maybe 10, and we will never be done, because the new data, new sensors, will continue to be coming to this world, and we'll be able to integrate it. And every time we integrate a new data feed, we do see improvement in quality of our prediction, and I do believe that if you think about the future of healthcare, the more precise your models are about progression of your disease, about the need for that ambulance and the ER visit, or about your likelihood of medication adherence or becoming addicted to opioids, the more precise we are, and the more we can then hook this up into systems of operation through our range of nurses that visit homes or the call center outreach, the more effective we will be in actually keeping you healthy and living longer. So that is a journey that will never be finished. But we are operational. We are doing great things today, and we are just at the beginning of our journey. I'm pretty sure.
Right. No, it's exciting. It sounds like you guys are definitely on this path. And again, just to kind of bring back to the final or around the aging population and bridging this digital divide, Dave, want to go, back to this Oates partnership, obviously with this goal of connecting, bringing online this next million seniors, I mean, obviously, like we talked about earlier, Humana, huge Medicare sort of, partner. So the aging population is a huge part of your member base. So obviously it's important to bring them online, but just talk a little about sort of, that Oates partnership and why now more than ever, you guys thought it was, you had to invest in sort of helping bring this population sort of online.
Yeah, well, I mean, the pandemic, whether it's in, death rates or, testing rates or vaccination rates, really has highlighted the disparities and gaps across different segments of our population, different markets, different geographies, right? And one thing that we've, the mission of our company is highly aligned to serving the member, and it just was more apparent than ever that those gaps, despite everyone's best effort, are still there. And so, I think we have to look at as many levers as we can to try and address those gaps. And we have a lot of internal efforts across different parts of the company to deliver human care, as we call it. But we're constantly on the look for sort of like-minded organizations whose missions are strongly aligned with ours. And I think that's where Oates really comes in. And this is not a new relationship with Oates, but it's really a doubling down, seeing the needs created by the pandemic and some of the unique sort of resources and focus that they have, and taking really an industry-wide kind of human approach to the whole thing.
Right. Great. Well, I think it's a really noble cause. I'll definitely, in our follow-up email coming later today after the end of the conference, we'll be sharing some information about Oates and how you can get involved. So really appreciate all the great work you guys are doing. Dave, Slawek, thank you so much for joining us today. And we look forward to hopefully seeing you in person in the not too distant future.
It'll be a pleasure. Big thank you. Thank you, Josh.
Right.
Thanks for having us, Josh. Good to see you again.